Brain tumours happen to about 450 people in Ireland every year, and a brain tumour is where a piece of tissue in the brain grows in a way that it shouldn't, and this can cause problem because it presses on the tissue in the brain, and it can lead to difficulties with how a person moves or how they think or how they speak. We're doing our research because the treatments for brain tumour can be really good in terms of surgery, radiotherapy and chemotherapy, but what can be really challenging for people after all of that is to return to their lives. Rehabilitation is a very important way of helping restore or adapt some of those functions. For rehabilitation, it is an inherently multidisciplinary and person-centred approach. That means it takes multiple different professionals who work with a person as an individual to determine what are their main problems and what are the goals that they'd like to achieve, and then set out a plan for how we'll achieve those things. For example, people can benefit from physiotherapy. So I've worked with people who had significant problems with their walking and their balance after a brain tumour. We can work on that through specific exercises that help people improve how they walk and move to enable them to do the things that matter to them. Similarly, occupational therapy can be really valuable around return to work or our daily activities. Speech and language therapy can be really helpful for people who have difficulties with speech and communication after a brain tumour. So everybody's different, but the main point of rehabilitation is that we work on what's important to the person with a very multidisciplinary approach. The Brain Restore research study is about understanding what rehabilitation do people need, and then joining the dots to help the services be available to that person at that time. So within the study, we're looking to speak to people who have a relatively new diagnosis of a brain tumour, and we're also looking to speak to people who had their brain tumour maybe some time ago but have gone on their own journey of understanding how they return to the activities that matter to them or what their challenges were. So by speaking to people and talking through what they learned and what worked for them, that can help us make a plan to benefit everybody after a brain tumour diagnosis. It is often the case that after a brain tumour treatment, people will finish their treatment in the hospital or under the oncology team that looked after them, and they may not realise that other therapies could help them with some of the problems that they're having. It may also be the case that where they live in Ireland, there mightn't be services that exactly match the expertise that they need. So through the Brain Restore research project, we're trying to understand what do people need after a brain tumour diagnosis, what do their families and carers need, but also what do healthcare professionals need to understand when they're working with someone with a brain tumour, and it might be the first time, or maybe not that frequent that they've had that experience. I feel very strongly that every patient who's had a brain tumour should have access to the therapies they need for their individual situation. So part of this research is to bring that idea into reality.